The Texas Health and Human Services Commission wants to cut programs for people with intellectual and developmental disabilities. These cuts specifically target Medicaid reimbursement rates for direct care staff.
Well, this rate hearing is regarding the Medicaid waiver that serves people with the most significant intellectual, medical, behavioral, complex support needs. He has 3 staff that he employs. What are your 3 staff? They're Miranda and Joni. And Martha? Yeah. And so Edward lives with myself, my husband, and his 93-year-old mom, Lucy, in Seabrook, Texas. And part of what we've always been about is staying away from the institutional, congregate, segregated setting. That idea is losing ground with this rate setting because what we see then is that people will have less capacity to live in the community.
On April 6, families from around the state came to Austin to testify at a public hearing before the commission and to rally at the state capitol.
My name is Mary Jane Williams, and this is my son, Christopher.
And I'm Christopher.
And we're here today because we use consumer-directed services through the Home and Community-Based HCS program, and we're very concerned about the rate cuts that are going to occur or that are being proposed in this program. We drove in from Katy. And we have been lucky enough to have an attendant that's worked with Christopher for, he told me last night, 10 years. I didn't realize it had been that long. And I worry that with the rate cuts that she might not work with him anymore. And that concerns me.
So Dean has 6 attendants. If they were to cut their salary, they would all quit. That is 6 people that we know will have to hire new people, train them, and at a significant impact to Dean. In the state of Texas, we are ranked number 50 out of 51 states and territories in how we take care of people with disabilities, and it's shameful.
These massive funding cuts will be devastating to people who depend on personal attendants to assist them with tasks of daily living in order to live independently in the community, avoiding costly and more restrictive living alternatives.
Now I have the opportunity to say who touches my body when I wanted to, because that is very important to me. And I could say when I'm ready to go to bed and when I'm ready to get up, and I can also decide what I want to eat and when I want to eat it. Because when I used to live in the group home, I did not have that opportunity. But now, since I've been out on my own, I get to go to a real live football game, and I can stay there to the end of the game. Because when I used to live in a group home, we used to could go to the game, but we had to leave in the middle of the game so the staff can do a shift change.
Well, I really don't want to think about it, but if I had to, it'd be kind of like going backwards, like either going back to the state school or going back into a facility as like a group home. It's better to be independent as an individual.
These rate reimbursement reductions will also exacerbate the critical staffing shortage in the direct care profession. Medicaid reimbursement rates that perpetuate poverty-level wages make it difficult to attract and retain qualified direct care staff.
I am a mom that spends a lot of time with my son. We have spent our years trying to give him a life of independence and self-determination. And part of that is finding the best staff for him and giving him the supports necessary to make him successful on his own, which everyone told me would not be possible throughout his lifetime. And so I feel very strongly that these rate cuts will affect the ability to get quality staff.
Irony of it could be that if these cuts take place, the people that work with Adam could potentially make less than Adam does at Whataburger. I mean, it's not even minimum wage. And that's just absurd.
When I asked them if they would provide testimony, he told us, "You guys are like my family, and what they're doing by cutting the rates is breaking up families, and that's just not right."
We have made it very easy for you to contact your elected officials about this important issue. Go to the link shown